Good afternoon, Dr. Jenkins. It's Mihira from Post-Op Recovery. I'm calling about Mr. Harrison, the patient who had the laparoscopic cholecystectomy this morning.
Oh, Mr. Harrison. How's he doing? Any post-operative nausea?
Initially, yes, he had some mild emesis, which we've managed effectively with ondansetron. His pain control is adequate with the prescribed PCA, and he's mobilizing well. However, I've noted a persistent low-grade fever, 38.1 degrees Celsius, for the last 3 hours, despite being well hydrated. His heart rate is stable, and his wound site looks clean, no overt signs of infection there.
A persistent low-grade fever, not ideal, but sometimes seen after general anesthesia. Mihira, any respiratory symptoms? Cough, crackles?
That's what prompted my call, actually. While his chest sounds are clear on auscultation, and there's no productive cough, his oxygen saturation has consistently hovered around 93% on room air, dropping to 91% with any exertion. He's also complaining of a slight, generalized discomfort in his chest, distinct from his surgical pain. This, coupled with the fever, suggests we might be dealing with something beyond just post-op atelectasis. I'm concerned about early-onset pneumonia, or perhaps a small pulmonary embolism, given his age and immobility before surgery.
Right, that subtle desaturation combined with a fever is key. We need to rule out anything serious. Mihira, I'd like a chest x-ray and full blood count immediately.
Will do, Dr. Jenkins.
Mihira, let's talk about removing your son's earwax. The procedure to safely remove earwax is generally quick and straightforward. There are typically two main methods we use, and both aim to clean the ear canal gently. One common method involves using a small suction device. This is a tiny, low-pressure vacuum that experienced professional uses to carefully draw the wax out of your ear canal. Alternatively, we might use irrigation, which involves gently flushing the ear canal with warm water to soften and wash the wax out. We choose the method that is safest and most effective for the consistency and amount of wax we see. The entire process usually only takes a few minutes. While it should not be painful, your child might experience a slight feeling of discomfort or a tickling sensation as we work inside the ear. As with any minor procedure, there are minimal risks. The most common minor risk is a temporary feeling of dizziness or vertigo. This usually happens because the temperature of the water or air slightly changes the pressure in the ear canal, but it almost always passes very quickly once the procedure is complete. We take great care to ensure the water is body temperature if we use irrigation to minimize this risk. Mihira, I highly recommend that you stay with your child during the entire procedure. Having a parent or guardian present is often very reassuring for the child and helps keep them calm, which in turn allows us to complete the wax removal as quickly and smoothly as possible. Your presence makes a real difference in their comfort level. Please let me know if you have any questions before we begin.